Before we begin, it's important to understand that this is not a medical examination, diagnosis, or healthcare service. The questionnaire and information provided are for educational and awareness purposes only. However, if your answers suggest you may have ADHD-like traits, we can help you understand those traits, explore practical coping strategies, and provide information about seeking a professional assessment from a qualified healthcare provider if you choose to do so. Now, let's begin. Have you ever wondered why some things seem harder for you than they do for other people? Why you start projects full of enthusiasm but struggle to finish them? Why you forget appointments, lose important items, become distracted easily, or find your thoughts constantly jumping from one thing to another? Perhaps you've spent years blaming yourself. Maybe you've called yourself lazy, disorganized, forgetful, unmotivated, or simply wondered why life seems harder than it should. But what if there is another explanation? What if some of the challenges you've experienced throughout your life could be linked to ADHD-like traits? Millions of people experience difficulties with attention, focus, organization, time management, impulsiveness, or restlessness. Many spend years wondering why they struggle with certain aspects of everyday life without fully understanding the reason. For some people, learning more about ADHD can be a powerful turning point. It can help explain patterns of behaviour that have existed for years. It can provide a framework for understanding strengths as well as challenges. And perhaps most importantly, it can help people stop blaming themselves for things they may never have fully understood. Many individuals who learn more about ADHD report that they feel relieved to finally have an explanation that makes sense. They often discover strategies that help them become more organised, manage their time more effectively, reduce stress, improve productivity, and develop greater self-confidence. Some find it easier to communicate their needs to family members, friends, employers, or colleagues. Others simply gain peace of mind from understanding themselves better. ADHD can also be associated with positive qualities. Many people with ADHD traits describe themselves as creative thinkers, problem solvers, entrepreneurs, innovators, and people who can think outside the box. Understanding how your mind works can help you identify and build upon these strengths. That is why we have created our free ADHD Awareness Questionnaire. The questionnaire is designed to help you explore whether ADHD-like traits may be present in your life. It is not a diagnosis. However, it may help you decide whether seeking a professional assessment could be worthwhile. After completing the questionnaire, you'll receive guidance designed to help you better understand your results and your possible next steps. If you would like additional support, we also offer a coaching service focused on practical strategies that may help with common challenges, such as managing distractions, improving organisation, reducing procrastination, building routines, setting goals, managing workload, improving productivity, and developing techniques that work for your individual circumstances. Our coaching service is educational and supportive in nature and is not a substitute for medical advice, diagnosis, or treatment. The goal is simple: to help you understand yourself better, to help you discover practical strategies, and to help you make informed decisions about your future. Imagine understanding why you've faced certain challenges throughout your life. Imagine learning practical techniques that could help you manage those challenges more effectively. Imagine feeling more confident about the next steps you choose to take. Your journey starts with understanding. Click the button below, complete the free ADHD Awareness Questionnaire, and discover whether further exploration could be worthwhile for you. Because sometimes understanding yourself is the first step towards moving forward.